Ebola, previously known as Ebola hemorrhagic fever, is a rare and deadly disease caused by infection with one of the Ebola virus species. Ebola can cause disease in humans and non-human primates, like monkeys, gorillas, and chimpanzees. Ebola is caused by infection with a virus of the family Filoviridae genus Ebola virus. There are 5 identified Ebola virus species, 4 of which are known to cause disease in humans: Ebola virus, Sudan virus, Thai forest virus, and Bundibugyo virus. The 5th, Reston virus, has caused disease in non-human primates, but not in humans. Symptoms of Ebola include fever, severe headache, muscle pain, weakness, fatigue, diarrhea, vomiting, abdominal pain, unexplained bleeding or bruising. Symptoms may appear anywhere from 2 to 21 days after exposure to Ebola, but the average is 8 to 10 days. Recovery from Ebola depends on good supportive clinical care and the patient's immune response. People who recover from Ebola infection develop antibodies that last for at least 10 years. No FDA-approved vaccine or medicine is available for Ebola. Symptoms of Ebola and complications are treated as they appear. The following basic interventions, when used early, can significantly improve the chances of survival: providing intravenous fluids and balancing electrolytes, maintaining oxygen status and blood pressure, treating other infections if they occur.
At least 24 cases have been treated in Europe and the United States. Many were health and aid workers who contracted Ebola in West Africa and were transported back to their home countries for treatment. The latest patient in the United States to have the disease arrived on November 15 and died 3 days later, while being treated in a biocontainment center in Omaha. Cases shown below are compiled from reports by the CDC, the World Health Organization, Doctors Without Borders, and other agencies. Since March 2014, West Africa has experienced the largest outbreak of Ebola in history, with multiple countries affected. In response to the outbreak, CDC activated its Emergency Operations Center to coordinate technical assistance and control activities with other U.S. government agencies, the World Health Organization, and other domestic and international partners. CDC also deployed teams of public health experts to West Africa, with spread the transmission of Ebola in West Africa has been controlled, although additional cases may continue to occur sporadically. However, because of ongoing surveillance and stringent response capacities, the affected countries now have the experience and tools to rapidly identify any additional cases and to limit transmission.
To stop the spread of Ebola, the World Health Organization is coordinating the construction and staffing of treatment centers across Liberia, Sierra Leone, and Guinea. Those afflicted with the disease will have a higher chance of survival at the treatment center and will be less likely to infect others, officials said. About 200,000 people are having problems getting food because of the problem caused by the Ebola outbreak. An analysis by the World Food Programme also concluded that if the disease continues to spread at the average rate observed since mid-September, as many as 750,000 people could lose access to affordable food by March 2015. With the travel curtailed or blocked in many areas because of the outbreak, the food transport system has been severely disrupted. Liberia's borders were closed in August, and cross-border trade has nearly halted.
The director of the Federal Centers for Disease Control and Prevention said that worker safety guidelines were not followed at the Dallas hospital, where a nurse became infected with Ebola in the course of treating a Liberian man who died from the disease on October 8. The director, Dr. Thomas Frieden, did not identify what the failure was, but suggested there should be further investigation of certain aspects of the Kirby, Texas Health Presbyterian Hospital. In the dose of page of Ebola information, the instructions for healthcare workers include a summary of the personal protective equipment that must be worn: gloves, fluid resistant or impermeable goggles, or a face shield, face mask over nose and mouth. Suggested in certain situations that involve large amounts of blood, vomit or other fluids, more protective equipment might be required, such as second pair of gloves, shoes covers, and leg covers. In his news conference, Dr. Frieden suggested that two procedures used in the treatment of Mr. Duncan were initial of an Ebola. Patient admitted that review respiratory intubating and dialysis treatment procedures can spread contaminated material.